Aspirin is used to lower fever and relieve mild to moderate pain from conditions like muscle aches, toothaches, common cold, and headaches. It can also help with pain and swelling from conditions like arthritis. Aspirin works by blocking a natural substance in your body to reduce pain and swelling. Always consult your doctor before giving aspirin to a child under 12 years old. Your doctor may also recommend a low dose of aspirin to prevent blood clots, which can reduce the risk of stroke and heart attack. If you've recently had surgery on clogged arteries, your doctor may also prescribe low-dose aspirin as a blood thinner to prevent blood clots. When taking Aspir-Trin for self-treatment, make sure to follow all the directions on the product package. If you have any questions, always consult your doctor or pharmacist. Take the medication by mouth with a full glass of water unless instructed otherwise. It's important not to lie down for at least 10 minutes after taking the drug. If you experience stomach upset, you can take the medication with food or milk. It's important to swallow enteric-coated tablets whole, without crushing or chewing them. The same goes for extended-release tablets or capsules, as crushing or chewing them can lead to increased side effects. Always follow the dosage and length of treatment based on your medical condition and response to treatment. If you're using this medication for self-treatment of headaches, seek medical help immediately if you experience additional symptoms like trouble speaking, weakness on one side of the body, or sudden vision changes. If you're taking this medication as needed, remember that pain medications work best when used at the first signs of pain. Also, do not use this medication for self-treatment of pain for longer than 10 days. If your condition lasts or gets worse, or if you think you may have a serious medical problem, tell your doctor promptly. If you experience upset stomach or heartburn, it's important to tell your doctor or pharmacist right away. Your doctor has weighed the benefits of this medication against the risks of side effects, and many people do not experience serious side effects. However, you should contact your doctor immediately if you experience severe nausea or vomiting, easy bruising or bleeding, difficulty hearing, ringing in the ears, signs of kidney problems, unexplained tiredness, dizziness, dark urine, or yellowing of the eyes or skin. Additionally, this medication may rarely cause serious bleeding from the stomach, intestines, or other areas of the body. If you notice severe or persistent abdominal pain, black or tarry stools, vomit that looks like coffee grounds, difficulty speaking, weakness on one side of the body, sudden vision changes, or a severe headache, seek medical help right away. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice symptoms such as fever, swollen lymph nodes, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA, and if you're in Canada, you can report them to Health Canada. Before taking Aspir-Trin, make sure to talk to your doctor or pharmacist if you have any allergies to aspirin, other pain relievers, or NSAIDs. It's important to also discuss any health problems you have, such as bleeding disorders, kidney or liver disease, stomach problems, asthma, nasal polyps, gout, or enzyme deficiencies. If you consume alcohol or tobacco, it's important to limit your intake while taking Aspir-Trin, as it may increase the risk of stomach bleeding. And if you are planning to have surgery, be sure to inform your doctor about all the medications and products you are using. For children and teenagers under 18, Aspir-Trin should not be used if they have chickenpox, flu, or any undiagnosed illness, as it may increase the risk of Reye's syndrome. And for older adults, they may be more sensitive to the side effects of this drug. It's also important to note that Aspir-Trin is not recommended for use during pregnancy, especially from 20 weeks until delivery. If you are pregnant or planning to become pregnant, be sure to discuss the benefits and risks with your doctor. And for breastfeeding mothers, it's important to consult with your doctor before using Aspir-Trin, as it may pass into breast milk and harm the nursing infant. Interactions with other drugs can affect how well your medication works and may increase the risk of serious side effects. It's important to keep a list of all the medications and products you use and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing any medications. Some products that may interact with Aspir-Trin include mifepristone, acetazolamide, blood thinners like warfarin and heparin, corticosteroids like prednisone, methotrexate, valproic acid, and herbal medications like ginkgo biloba. Make sure to consult your doctor before using this product if you have recently received certain live vaccines. Be sure to check the labels of all prescription and non-prescription medications carefully, as many contain pain relievers or fever reducers known as NSAIDs. To prevent an overdose of aspirin, always read the labels before taking other pain relievers or cold products to make sure they do not contain aspirin. Consult your pharmacist for guidance on using these products safely. Daily use of NSAIDs like ibuprofen may decrease aspirin's ability to prevent heart attack or stroke. If you are taking low-dose aspirin for this purpose, consult your doctor or pharmacist for more details and to discuss other possible treatments for pain or fever. It's important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this drug. If you suspect that someone has taken too much Aspir-Trin and is showing signs like passing out or having difficulty breathing, it's important to call emergency services immediately. You can also contact a poison control center for assistance. Symptoms of an overdose can include burning pain in the throat or stomach, confusion, fainting, weakness, ringing in the ears, fever, rapid breathing, changes in the amount of urine, seizures, or loss of consciousness. If you take Aspir-Trin regularly or in large amounts, your doctor may want to do some tests to check your liver, kidney function, blood count, and the level of salicylate in your body. It's important to keep all your medical and lab appointments. There are different types of aspirin products available, some with special coatings and others that are long-acting. It's best to ask your doctor or pharmacist for their recommendation on which product is best for you. If your doctor tells you to take Aspir-Trin regularly and you forget a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. Keep Aspir-Trin at room temperature, away from moisture and light. Different brands may have different storage needs, so check the product package or ask your pharmacist for instructions. Don't store it in the bathroom and don't use any Aspir-Trin that has a strong vinegar-like smell. Keep it away from children and pets. When it's expired or no longer needed, properly discard it. Consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.